Hi everyone.
Evening.
Sorry, we had a bit of technical difficulties, so we started a little bit late. Um, so today we're going to talk about previously I'm in episode 17. We mentioned there is a hyperthyroid patient who I treated a couple years ago, and we recently have an update from her. And I saw her just a few weeks ago. So let's have a recap. When I saw her, she was usually feeling very cold, and she has a lot of diarrhea, about 9-10 times a day, and she could also see undigested food in her stool, and then she has a lot of soreness in her legs, so she couldn't stand, she couldn't walk, and then about 6 months of herbal medicine treatment, her doctor agreed to stop the medication for hyperthyroid, and then she continued herbal medicine for a period after that, and she hasn't taken anything until now, just recently. And so all the numbers, the blood tests were okay. I think the last visit to her doctor, her doctor still suggested that she takes about half of the pill a day, but she didn't want to take a pill. I think it was just precaution. The doctor was probably doesn't think that anyone could get better from hyperthyroid without taking any drugs. So she didn't want to take any more medication. Her blood test is quite normal, and when I see her, she now has like a different. Her body type has changed. She is now a very hot person. She tend to feel hot. She doesn't need to wear too much clothing in a colder temperature, and she sweats very easily. So she has kind of turned, and she no longer has diarrhea. Her poop is very normal, once a day or even twice a day with finished solid form. But the recent problem she has is that she tends to sweat more, and especially during her sleep. And she is about 54 years old now, and she just her last period was I think in the past 6 months or so. So her period stopped. She went into menopause. She has a little bit of we call night sweating. And she tends to be more thirsty and tend to feel very hot. Also, she has a bit of a palpitation, that she could feel her heart beating when it's quiet. And during her sleep, she needs to get up to pee about twice per night. So overall, her body type has changed from because when I first saw her, basically she was her body is kind of separating. It's very cold from the inside, but it's hot on the very outside. So now everything is more even. She's a little bit on the hotter side. So this time I gave her a different type of medicine to kind of improve her water metabolism to reduce this heat. So when the person is very thirsty and also have urination issues, like like when she needs to get up at nighttime to pee, uh, this type of abnormality, and combined with her body shape, she's like a bit of a stronger build, wider body type of person. So with this type of body build, we tend to think it's more excess. So when she has water passage issue and she's also excess, we tend to give the formula. It's called 503, which is regulate her water passage so the water can send up to her mouth so she doesn't feel as thirsty, and then also regulate her urination so she doesn't need to get up at night to pee that many times. So I only saw her for a week. I saw her twice, and after a week of medicine, she was feeling a bit less thirsty, and then she realized she doesn't need to get up at nighttime to pee anymore. She can wait until like early morning, like 7 or 6 a.m. So so it seems like the medicine is on the right track. So I just tell her to keep taking that until her water passage problem is normal, and then she can stop medicine.
I have a question. Instead of giving her 503 to regulate her water passage, let's say if this person is coming from an area that's warmer, and why not just give her, that means she doesn't need that much of heat in her system. Why not giving her something like 石膏 to cool off her body?
Yeah, actually,
so she doesn't sweat as much then.
Yeah, I actually thought about it, and I did give her 石膏 to add into her medicine after second visit, because she's still when she's thirsty, she really wants to drink her like really, really cold water.
That means there is heat in her system,
it indicates there's heat in the upper chest, in the lung. So 石膏 is a very good medicine to reduce this heat. But I just give her a little bit to try, see if it helps, because I'm not exactly sure whether we need this right now. If she keeps taking 503 and the thirst level hasn't changed and she's still craving the iced water, then I would probably add in 石膏for sure.
Okay, yeah.
But because she doesn't live here, I can only see her twice, and so there's a bit of a testing she needs to do on her own.
Okay.
Yeah, so when the person is very thirsty and she likes to have...
He just burped.
Oh,
too much food.
Too much. Okay, you need to stop now.
Okay.
So when this person is very thirsty, tend to sweat a lot, tend to feel very hot, and likes to only drink cold or ice water, and this ice water makes her feel more is able to quench her thirst better, that's an indication for 石膏. So, but 石膏doesn't necessarily have the urination issue.
Oh, okay.
So that's why I was hesitant to add it in the first time first time I saw her.
I see. Okay.
So maybe she will need it.
Okay, then we shall give another follow-up then.
Yeah, so that's the case, and if you have any questions about hyperthyroidism or even hypothyroidism, feel free to leave a comment or even anything related to what I said in this episode, feel free to comment. I'll try to answer as best as I can.
Or just private message us then.
Yeah, private message works too.
Yeah, alright.
Bye bye.
Bye bye.